So you can see um, our racial ethnic composition, how many students we have, and that we are an 82% free and reduced lunch school. But when our BMI 2016-17, we came back 10% overweight, 22% obese, which is one of the highest in Broward County. So we, as a PTSA, partnered with Flippany to create healthy programs and a healthy partnership to try to increase healthy food choices and health awareness just in the school in general.
And so a little bit about what we do, and so a lot of what this is going to be discussing about our presentation is really the value of strategic partnerships, right? And so when you are able to combine with different
Yes.
partners, whether it be community agencies, academic partners, you're able to increase the opportunities that you can provide. You can help each other leverage resources, and then you also allow for there to be more sustainability over the years. So I know Sharon had already started to discuss a little bit regarding our partnership, and our partnership actually started, so Flippany started to provide programming at Deerfield Beach Middle School in 2015. Yes, exactly. So in 2015, we were offering programming at Deerfield Beach Middle School. Similar to what I was mentioning, how we provide programming in a lot of different organizations throughout the county. What differed with this particular relationship and what allowed us to pilot something completely new was that while we were there, the principal at Deerfield Beach Middle School actually came to us and said, you know, we just got back our BMI surveillance. The principal that was there at that time was also very concerned about wellness because she herself had some incredible success regarding her own wellness and how it had been able to improve, you know, just her specific self-esteem, her health issues that she had been having. And so she really wanted to be able to bring that to the school. So she brought us to the table. We had a relationship with an academic partner, which was Nova Southeastern University, previous to all of this. And so previously, we had already had this connection with Dr. Jessica Valenzuela. And when we discussed with her a little bit of what the principal at Deerfield Beach Middle had mentioned, she had told us about this opportunity from PCORI, which is Patient-Centered Outcome Research Institute. And I mentioned that because that could still be an available resource for those that after this yes. presentation, if you're looking to see ways to start something similar, this is a funding opportunity or an agency that still offers funding. And so what they did was they actually provided funding for us to create this board, right? So this partnership. And a lot of times it is hard to actually find the funding to create the initial steps for you to be able to pull these partners together because it does take effort, right? So that happened in 2013. We actually were able to then, our very, very first relationship we built as we moved that along was with Sharon, with Raihana as well, which is also a board member, with the vice president of Deerfield Beach Middle, Ryan.
Assistant principal,
sorry.
That's okay.
Assistant principal,
yep.
Ryan. And then we also had a few other parents that were there. And at that point, we also had the school health nurse that was part of our that initial partnership as well. And so yeah.
So when we started, so Flippany and PCORI, we had this grant, and we had so when PTA came in, so this is how your PTA can be involved in these processes, right? So we had this group that wanted to come in and help us fix this problem that we have in our school. And PTA became the resource, right? So we were able to pull the volunteers. We were able to be the people on campus to get things done. We were the ones able to provide the sustainability for the program, get the kids involved, get the kids community service hours. And we developed this new group together. So with the funding from PCORI and with the work from PTA and the school administrators, we built this new group called Healthy Students, Healthy Communities.
And so initiatives you can see here, after having a few discussions, we had, a partnership developing a culture of health in Deerfield Beach. We really wanted to think big on it. These were the initial partners that I had mentioned. So,
There we are.
Small, exactly. So we started small, and not everyone's there. Actually, it was just one of the pictures that I was able to find. And before, at this time point, we don't even have a name yet, right? We're just trying to get together to see how we can create a group that can start to incorporate health and wellness within this school, right?
Right. And a sustainable group, right? You don't want something that's going to like, oh, we have a problem. So even when the funding runs out, right? So we had this grant, but what if when that funding runs out, how do you keep it going, right? So that was part of where PTA came in. So no matter what happens, now that group is part of our PTSA budget. It's part of our PTSA going forward. And now we also have built these community-based relationships through this new group that we've established. And Christine's going to talk more about this community-based approach because that's what Flippity does, and that's how she brought us in.
And so, and actually, the one that taught us about it was our academic partner was Nova, and you're probably going to hear a lot. It's starting, even though we started this already 3 years ago, we're starting to hear these phrases, right? This community-based participatory approach, which is a mouthful. It's also why at the bottom I put it's also called community-centered approach. And it's starting to be a catchword now, right? So we were, I don't want to say on the forefront, but we did start this before it started to become something big in this health equity sphere. And so if you start to research now, you're going to find that there's going to be a lot of funding opportunity regarding this phrase. So if you start to search for community-centered approach, community-based participatory approach, you're going to find a lot of information. And the idea of it is it's really basic at its essence, right? It's this kind of shift in thinking of stopping a lot of what these wellness initiatives would do many times when they come into a community is that it had a top bottom approach, right? So a nonprofit would come in, an association would come in, they'd say, I want to change something in this community, and this is how I'm going to do it, right? And so there's really this very big shift right now, which takes more time, but the idea is that it becomes more sustainable, that you create this equal decision-making body, right? So you start to involve community residents. You do it in a way where it is collective. You do it in a way where you start to create a government style way of making decisions, right? So you think this idea of a board,
right?
And then you start to even think about how you can build in an infrastructure that if you're asking for residents to volunteer their time, right? If you're asking for parents to volunteer their time, if you're asking for residents to volunteer their time, that you also start to think about how you can incentivize them and also give them a value for their time. So some of these even allow for you to be able to actually compensate your community members for their time and for the amount and for the activities that they are performing, whether that be at the level of authority or at the level of bringing in the initiatives into your school. So as you see here, some of it is really being able to recognize the community as a unit of identity, how to build that collective strength, how to facilitate that partnership. What I mean, that equitable partnership is really talking about how do you build in stipend to ensure that if you want someone to participate in this that might not have the same opportunity of time, maybe they are deciding that because they're coming to your group, they're taking time from, say, their job, right? This is a way for you to be able to build in their time and get people that wouldn't usually come in and represent in these types of boards, right? And so it allows for this long-term process and commitment, and it allows for a bottom-up approach.
Yes. So this is how we started, right? So we brought all the members in, right? So we had some people from, so we had PTSA in, we had the school administrator, we had the school nurse, we had parents, we had people from Nova, we had all the people, and all the people. And I actually, so when we sat down, when we first started talking about it, and we were making this new group out of all the people. Here's me from PTA. We need some bylaws. We need some rules. We need some governing documents. We can't just be all willy-nilly. We need to have a whole structure. So
this group doesn't have its own 501c3. So go ahead.
Yes,
So
it's a separate group, but because it's a community group, we're able to we've built this group, right? But because it's a part of our school community, it's part of the neighborhood community now. We've got parks and recreations involved. We've got PTSA involved, and the school administrators, and everybody's involved, but everybody's got their own role and their own part. So it's a great way. And this is health and wellness because that's our focus, because that's our thing, but you could really use this to whatever your issue is in your school. If it's mental health, or if it's whatever it is, it's a way to build a group in your school that will focus on the issues in your neighborhood or your school community. And health and wellness is also a passion of mine, obviously. That's what I do for a living, right? I teach group fitness classes. I'm a personal trainer. So these are issues that are near and dear to my heart as well. So this is something I jumped all in. But when we started creating our documents, I actually let's look at the bylaws that PTA has. Like, how do we build new bylaws? How do we build a new group from what I've learned from PTA, right? How do you make it fair and equitable and a good equal partnership? And this is how we started. Christine can talk more about the
implications. So this was our very first year before we started. This is again going back to we're 10 people in a room, right? Yep. We just got ourselves together, and we're going, what do we want to do here? What is it that we're doing, right? We have all of these different kind of misalignments, right? Because everybody has their purview of how they view the world, even if you're all looking at the health and wellness spectrum, right? And so what you want to do with this is you want to bring everybody together on a common mission. And you also want to gather the information from the people that can't actually be there, right? Because you are 10 people in a room trying to get a representation of a larger body. So the first thing we did, as Sharon mentioned, is we started to think about these bylaws, and all these things are happening at the same time, right? The next part is, how do we obtain community feedback, right? So we did a lot of different things. And part of that, we had held this family night where we invited experts in the community to be able to get some feedback there. It's called the World Cafe Method, if anybody wants to look that up. We also held student focus groups. So we went into the school and we had our doctoral student from Nova Southeastern University actually speak to the students and start to get an idea of, in a student's perspective, what is it you would like to see change in your own school? And so we brought that feedback back to this parent group. We also gave training to the parent group on community participatory approach, this community-centered approach. And the one that gave us that training was actually, our academic partner, because that is what they are experts on. And together we came up with what our shared vision was, right? And so our shared vision was, it could have been so many very different things, right? And so that's why you really want to get into saying, what are these kind of three main pillars that you want to create your group on, right? And so what we said we wanted was that we wanted to improve access to community resources. We wanted to implement nutrition and physical activity initiatives within the school, and we wanted to engage youth in a meaningful way. Yes. Obviously going towards this whole wellness idea. How do we create these leaders within our own school so that it's not just the adults saying the same idea, right? It's not the adults just saying, we want you to do this, but we're also giving a voice to these students, right? And so these initiatives started to take action and to take fruition, right?
Yes.
And so the very first thing, so from our first grant that we got, which is the PCORI grant, and over that year, we got about $30,000 to be able to just have the time and energy to create all of these incentives. It was $15,000 throughout a 2-year spread. And then after we actually got this whole time that we were discussing, we got the ECMA grant to be able to pay for our school wellness coordinator, right? So by being able to create this kind of structure, we were able to we used Flippany as a backbone agency to be able to apply for the grant, but you could do it any which way. Like PTSA, for example, also has their nonprofit 501c3, so that they could also be the backbone to apply for some of these grants.
Yes.
And our very first thing that went on was to pay for this wellness coordinator, because what we found while we were doing all this is that even though we had all these great ideas, right, who had the time to do them all? We all had our own jobs. So if you want to keep, I can give you the floor, Sharon, if you want to.
Oh yeah, and even so I run to your PTSA president, right? And that's still my thing, right? But I'm part of this other group. So when you're able to, as a separate group, it's a separate thing. So you can, as a PTSA president, so what can I do to help this group function, right? So I help with the volunteers. We run, because it's also part of our because the student part is part of the PTSA part, right? So we help with the student communications for this group. We run the program from the school. Can you go to the next slide that has some of the challenges that we did? So we did a water challenge, right? So it was how much can you drink water instead of drinking soda. And we did PTSA did a water event where we gave water out every day, and we did flavor water challenges, and we did, help me, a survey. I couldn't think of the word, right? We did a survey where we encouraged them we did the 30-day challenge, but we also did a survey, and the kids told us they wanted water fountains and they don't have access to fresh water. Some of the other things we did as PTSA as part of this group was we did a marathon challenge, right? So this was one of the physical activities that we did. So the group, Flippany helped us. Flippany does a walk every year or a run, and they were able to give us free sponsorship for all the students to participate in the run. And we gave them little counters for their steps, and they logged them onto a website, and we collected their sheets and we passed out the prizes as PTSA. So there's ways that you can incorporate this separate group with your PTSA to encourage, because wellness is advocacy, right? So if your kids are well and they're healthy and they're physically engaged and mentally engaged, they're going to do better in school. And obviously advocacy is always our number one goal. So health and wellness is always, should always be a priority for all of our PTAs. So,
and so one of the first things that we were actually able to do, so as Sharon mentioned, we did the water challenge.
Yes, which was awesome. Everybody loved it.
Our actual
sorry.
Our very first thing that we were able to do the first year was, I don't know if anybody's seen this before, but this was our first initiative that we were able to get done. Yeah. It was at the county level. Originally, these are the BMI percentile letters that go out to the parents. And as I had mentioned in the beginning, it was one of the first reasons on why we had been called over there, right? So we were actually able to get some information. The original ones were just a very plain black and white letter that were going out to the parents. And we were hearing from the school that the parents would receive this letter and actually sometimes would be angry to receive it. They weren't getting enough information on it. And so by receiving some feedback from the different parents, as well as administration, we actually revamped the way it looked. And this is still something that is still going out each year. We were able to provide a little bit of information on, what was the main guidelines, as well as some resources to go to find out some more information. And just to give it a little bit more color so that it didn't seem like such a negative letter. And we were able to receive some positive feedback from that.
And a better response from our parents that we're not, there's no judgment here, right? We're here actually to try to help you, instead of parents getting very angry and defensive when they would get those letters. So that was a big push.
So that was one initiative that we had started as well, that is still going on 3 years later.
Yep.
And second part of what we were doing was that whole, how is it that we're going to be able to engage the youth in this? And so the next thing we did was to create, this is our flyer for the Youth Health Advisory Committee. Again, as Sharon mentioned, it was led through the PTSA. The parents actually are the ones that co-lead this group, right? So we sent out this advert. We got a group of kids and we taught them to kind of mimic exactly the same thing that we were doing, right? How do we teach students to build their own board? And so we did the very similar things when we started their board. So we did this whole World Cafe method, which is, I'm sure many of you have done it before. It's the idea that you start to get everybody in the room, everybody gives out their ideas about what they want to do, and then everybody starts to vote on what it is that the ideas, what goals start to align, right? And so if you started with 10 different ideas you want to go, you now have narrowed it down to 3 actionable goals. And our very first thing that the kids had created was a name for this initiative, right? So it gave them that idea that something was theirs, and it was no longer this kind of beast that came about from this adult board, right? And this is where the Health Hub was created.
Originated, yeah.
And so our adult group is the Healthy Student, Healthy Community group, which oversees the Health Hub, which is the student group that does wellness initiatives within the school. And the Health Hub, whenever we write in our grants, we make sure to actually provide some funding for the students to oversee their own projects. And again, this is by the support of the parents who are supporting this youth, but it's not to tell them what they need to do. They're just there to guide them,
yes.
And hear them and show them how they could lead it. And so this is actually the group, and this is one group here. These are the students combining together to learn about health and wellness. So that, Sharon, what is it called again when they do the it's kind of like.
This was a recipe challenge, wasn't it?
Yeah, and they do, is it Kazan?
It's a Kahoot.
Kahoot. So we do, so we start off the meetings with Kahoot. And what a Kahoot allows you to do, I'm not sure if anybody's familiar with it.
It's like a quiz, yeah.
You do mini quizzes. Our mini quizzes are around health and wellness. It just is a fun way to start getting them engaged. And then we start to talk to them about what it is that they want to do throughout the year. And the very first thing that they said they wanted to do was actually a healthy cooking club, right? And so that's exactly what they're doing here. This is one of the pictures that we have. We did healthy whole wheat blueberry pancakes. So we got, even that was part of them being able to decipher what it was that they wanted to do. Our very first meetings at the Health Hub, what we would do is our first meeting would be more of a board meeting, right? We would utilize that board meeting of the Health Hub to decide, what recipes they wanted to make, how was it that they were going to create this cooking club, what equipment did they need, how much money would they need to be able to buy that equipment. The students don't actually buy the equipment themselves, we buy it for them. So if anybody's asking in terms of, regarding students and funding, that's something that the adult group is able to oversee and then buys the equipment for them. And then they were able to lead the Healthy Cooking Club themselves. Another thing that actually came from the feedback that they gave was also being able to have access to the gym as well. And then from the focus groups that I had mentioned beforehand, which was school-wide, we were able to get some feedback regarding changing the water fountains.
Yes.
So we'll see how all of these start to come into play year after year. So our first step was we created that water challenge, which Sharon had mentioned. We had a 30-day water challenge. And a lot of the kids, we had the kids recording their how much water they were drinking. We started to hand out, if they were part of this water day challenge, we created incentives with these little bracelets that said drink more water, and you would actually see the kids around the school wearing these bracelets.
Yep.
So little things like that really did make a big difference. And at the end, we did this huge event where we had
the flavored water day. Yeah,
exactly, flavored
super
water.
fun.
And you would see that the kids were actually really getting involved in this. You would see in our food demonstration, which we didn't even expect, we had a line of students outside of the cafeteria. And I wish I had a picture of this. I thought I did, waiting to get their healthy food tasting.
Yeah.
So obviously we know how to make it better for the following years. As a part of this, also what we had mentioned was this marathon challenge. It was kind of this a similar concept.
Oh, yeah.
And everything that we do comes around this whole idea of evaluation and how do we make it better.
Right.
And that's how we involve our academic partners, again, Nova Southeastern, which actually allows us to see how any kind of initiatives that we do, how do we really think about how we do as a pre-survey to see where we started off at, and then how we use that data to make it better.
Right.
And again, to help us with this funding. So the original thing that we had done with the school health index, the school health index is a CDC. It's the CDC's measurement or best practice for when you're first starting out to do health initiatives within a school. How to start to estimate where your school has started at, right? So where are you at to begin with? So you can easily document where you started from and you can document your improvement over time.
Yes, progress every year, right.
Exactly. And as part of that, you're connecting your PTSA to see what your PTSA has done within the school. You are connecting your school administration, your food and nutrition department, all of the different, your coaches at the school as well, and understanding all the different components in terms of policies that they're already incorporating at point 0, and then seeing how that's improving year after year. And the end goal is to get the maximum amount of points in each section, right? And so that's something that at the start of each school year, we look at, we redo, and we see what our next year's goals are.
Right.
And so this is actually us, following our year 3 goals. We're actually a food recovery program. And so
yes,
all of these things, again, start to build on each other. So what we started to notice, and from the feedback from the students, was all of this waste that was going on in the school cafeteria, where the students were throwing away food, and then it was perfectly usable food, and how we can reincorporate that. And if you want to talk a little bit, Sharon, about how you initially heard of this and then brought it over to our group.
so so I sit on the Health and Wellness Committee for the county, and I heard about this from Elaine from Beachside Montessori, who does the food recovery for the whole county. She initiated the whole program from the county. She was actually at our conference last year for Broward Leadership. And I immediately was fascinated, wanted to learn all about it. I wanted to bring it back to our school. And so we, it has to be run through a group through school has to be the sponsor of it, right? So PTSA is the sponsor of this program. But because we have this funding with this grant and on this Healthy Students, Healthy Community Board, we were able to purchase the items that we needed to fund it. So I went to a training with Rayana. She's the one that's pictured here. We went to a couple of trainings. I personally went to about 5 meetings on it because the protocols kept changing, right? So it just took us forever to get it rolled off the ground, right? And we actually had we did a day of don't throw anything away. This is bring your waste up to the table. And we're going to look and see how much food we're actually throwing away. And this is one day's worth of lunch of how much food was getting thrown away.
And this is actually not, and it was 1 day worth of lunch when there was a really big, it just so happened that the day we ended up deciding to do it.
It was a field trip, right?
Yeah, half of the students were actually out of school because they were on a field trip. And so you could just imagine how.
So the food recovery, what it is any food that's unopened and still packaged as soon as it comes out of the cafeteria, the food can go into my daughter just walked in. Hello, daughter. So any food that's unopened and in a package like the fruit cups or the milk can be recycled, right? So the kids can put it as soon as they come out of the cafeteria, it goes into like an ice bin. Any kid that's still hungry can come up and get it. And then any food that's left over gets donated to a food bank. So all of that food gets recycled into our community. And if you remember that slide from the very beginning where it showed the poverty index level in Deerfield Beach, the free and reduced lunch that we have in our school at 82% free and reduced lunch. We have hungry kids, and we have, so this is what, thank you. So this is what our baseline evaluations are, and this is what the program that we're trying to initiate, right? So we actually had all of our trainings. I had a big training that week, right, Christine? I don't even remember what it was, but I had like 10 people there. I'm doing this big, huge training. And then literally 3 days later, we got shut down for COVID. So we really never even got it rolled off the ground.
Right when we were about to start, it was the exact day that we were about to start was actually March 16th, which if anybody remembers what March 16th was the day Broward schools shut down.
Yeah.
But
But it took us that long. So if this is a program anybody wants to initiate, it takes a good 5 or 6 months to get it off the ground, because you have to sign up with sign up with the school board. You have to sign up with food recovery. You have to sign up. I mean, there's a lot of process to it. But if you look at the waste, it's the food right. We did the food insecurity. My daughter's yelling. I'm sorry. I'm very distracted now. Sorry. So even here though, where you see the youth that reported feeling hungry was 16%, and they say they don't eat, they're hungry. Like, they're not even going to be honest with you, even when you're doing these surveys. So the schools that do this, like Beachside and some of the other schools that have been active in this for a long period of time, like 70% of the food that they recycle that through this food recovery gets recycled in their own schools. And then the rest goes to a food bank. And their free and reduced lunch at Beachside is not nearly what ours is.
No.
So that's the point, right? So that if you know you have hungry kids, and you know this food at the schools is on the pyramid, right? It's all healthy, nutritious, part of the food we want our kids to be eating. So that was a big priority of ours, to make sure that kids had access to healthy food. And then we also, so the part of the program is to recycle through a food bank. And we're trying to get permission actually from the county to recycle it in our own school, to have like just a food bank within our own school, right? Where the parents can come and we can recycle it within our own school community, versus and if we can't, we can. If we have to use a food bank, we will. But we know our families are hungry too. So if we can recycle that food into our own school community, to know that all of the families are taken care of too. Health and wellness isn't just about the kids, right? Health and wellness extends to our whole community. So if the kids are healthy and well, and their families are healthy and well, that increases. They see that we're engaged, that our school is engaged, that we're advocating for them, that we're making sure that they get the resources that they need. So that's part of this program as well.
And so part of what you want, you're looking at this research, I put it in here as an example of, you want to make sure that whenever you start an initiative, you take the time to think about, what is it that you're trying to understand? And so
Right.
You want to be able to do your pre-test before something starts. That's the reason why we did this, because we didn't just want to start the food recovery and then not really be able to have the data to show, right, what was happening beforehand. And so this speaks volumes when you're able to say, it's funny because when we were doing that, already the children, as part of their protocol, right, and I'm sure many of you are familiar with this, when they don't want something, they go directly into the line and then they just throw it out in that bin, right? And I think that what happens is that a lot of people don't really notice it. And so, you don't see it all together. And you just it's just part of the policy and part of the procedures, and we just don't think about it.
And part of it, I'm sorry, I don't know if everybody knows too, they're required to take certain things, right? That's part of free and reduced lunch. They're required to take. So even if they're not going to eat it, they're required to take it. So that's why there's so much waste. Sorry, I just wanted to throw that in there. Go ahead.
And so what we realized is that when we went to go and throw all of this food away,
God, it's so crazy.
You really could see that it would pull at your strings, because what we had to do, because we at this time point we didn't have the authority yet from the school board to
recycle,
actually share table and recycle it. we had to grab all this food and throw it right in the garbage can. So even after we had quote unquote recovered at this moment, because we did not have the capacity and authority to do yet, we had to go in and grab all this and throw it in the garbage. And at that point, since people were seeing us do it, it was almost like, what are we doing? You know, it was just kind of a, sacrilegious, because you could really, it was a great visual, right?
Yes.
And so there's two things you're doing. I mean, that allowed for the visual. Part of what you're doing is always think about what is your baseline data that you want to get. I think when you're also creating that baseline data, sometimes you want to ask all these questions. Just really think what you're going to do with that information before you give that out. Because with that little bit of that perspective, you could narrow down your questions really to really what you're going to need. You don't want to overwhelm. And it just can give you, this data gives you the information to say, all right, what is our next initiative going to be about? And also, how can we use this data to really be able to have a successful program, right? This is another example of something that we did too. We're looking to see how we can start to incorporate some wellness in the terms of receiving of stress reduction. And so the first thing that we did was we implemented a survey about, what was the students' stress level at this time point? And what you would notice is that everybody felt around here, right? You would see that the grand majority of students are really in this kind of sometimes. And there's a lot of here that if you're thinking about what some of these questions are in the last month, how often have you felt that you weren't able to control the important things in your life? How often have you felt things were going your way, that you could not cope? You had a good amount of children that were falling in this sometimes. And then also this still, when you think about 8.4% of 1,200 students, that's not a small number. They're feeling this often and fairly often. And so we use this information to arm us on what we should do next and what our next initiative should be. And so this year, which is obviously changing a little bit because the school is out, but this was done right before COVID had happened, when we took this data, was how is it that we were going to promote our physical activity and our stress reduction. And some of the ideas that we thought of, was the development of before school opportunity for students to engage in stress reduction, so yoga and mindfulness. As well as the opportunities, which had ring several times before from the student group, of being able to give students access to things that they really wanted, whether that was the weight room after hours, or even maybe during PE, or access to their gym after hours. And so how we really wanted to be able to use that to incorporate this kind of stress reduction activities. And so again, this was information that I got back from the slide that our academic partner had done. What they help us do is they gather all that data, and then they incorporate it and utilize it into something that the board can use,
right,
to be able to decide what
next
they're
steps, right?
Exactly. And so that just goes into a little bit about what it is. You can see there what we're going to be doing next year regarding the share table, a little bit about what we had mentioned before, how we're going to create this, incorporate a school pantry, because it's not just about saving this food, but then how do we redistribute it so that we first give access to the students that are there at the share table, but then so that we don't have to throw away that food, we're going to create that food pantry. And as a second part to that, we actually thinking of how do you create vendors? So, how do you become a food agency within, for example, Farm Share or these food pantries, so that we can actually bring additional food items to these families. And so that was the next project that even with COVID, we've already started, right?
Yep. So we just did this past week, right? So we are hoping to do a large food distribution, but it's been kind of a nightmare, right? Just the US, there's a grant process, and it's just been kind of all the processes have changed with the new grants. So we just did a smaller event, but we got 75 boxes, and we distributed at the same time that students were picking up for their free and reduced lunch. So there we are. So PTA, so that's some members from my PTA, and we got the volunteers, and we used the money from the grant to buy the boxes, and we were able to do this drive-through. We're going to do it again this week. And I met up with the League of Women's Voters today and got some information about voting. So we'll be able to put those things in the boxes. So even with these events, so it's about food and health and wellness, but it's also about advocating for our communities, right? So what else can we do at these events to bring awareness and mindfulness to our community, right? So here's your box of vegetables and don't forget to register to vote, right? So it's all of the thing, because if as a community-based project, you can't get things changed if you're not civically engaged, right? So you have to be aware of what's happening in our community. So every time we do one of these events, we're hoping to bring a partner or someone from the city or a vendor, or not a vendor, someone from the city or Parks and Rec, or somebody from the League of Women's Voters or something, to help engage our whole community.
Items that they need.
Yes.
We're also going to be doing the hygiene, so essential hygiene products that we see that students might be lacking, which was really one of Sharon's big goals that she wanted to ensure, to make sure that people, you know, a lot of times we think about health in terms of food, but it's also can be a really big, you know, it's important to be able to know that you have the essential simple things like, you know, tampons, soap, body wash, toothbrush, toothpaste, all of that is a part of your daily hygiene. And so that's going to be part of our long-term vision in terms of the school pantry. Right now with those boxes, we were able to get 75 and do it each week. Our big goal, if you have the chance to take a look, there's a farm to families right now happening through COVID. And that is actually the USDA is providing funds to farmers to be able to provide 30 to 40 pound boxes for a food distribution. So we have been able to make that connection, but the way that that functions is that you have to have the connection with your specific farmer. And so each farmer has the capacity to be able to, they have their own area they're able to serve. So we're hoping to find, unfortunately, we were able to make connections with 3 different farmers, but those farmers didn't have the connection with Deerfield
County,
on the lookout. But that really has the capacity to be able to serve up to 2,000 boxes, 30 to 40 pounds, all for free. So there's just so many different resources out there to be able to make these combinations. And that's how, by building these partnerships, right, that's really how you're able to leverage these different types of resources. And so I'll, you know, just I know we're kind of coming into our final hour, so I can go on in terms of that kind of call to action. There's a capacity for you to build your own network, right? So you as the PTSA, we might have started, you know, Flippity might have been the one to kind of start this and then bring in the PTSA. This can happen any which way, right? So this can happen, the PTSA is the one who wants to start this and build this kind of connection, right? And you guys have so much more capacity at the end of the day than even we do, because you already have so many links to different organizations that you can really kind of bring together to just have so much opportunity out there.
And when you talk about these kind of connections too, because you're already in your school, you already know what your issue is, right? You already know. So in Deerfield Middle, it was health and wellness, and it might not be that in your school, but you already know what your needs are. So what agency, and right now especially, agencies are looking like you can reach out and find those agencies and figure out how to establish these connections. And when you have the PTSA involved or PTA involved, it becomes long-term, right? It doesn't have to be a one and done. And that's so many times when we're doing these things, it's a one and done. And this gives it that longevity. It gives it that, when I am long gone, whoever is there after me will be able to keep this good work going, because it's a established entity that's still, but it's entangled with our, you know, entangled's maybe not the word I'm looking for, but it's because they're both there and they're both sustained by each other, and it gives you that longevity that will help bring continued change to your school. And those are the connections that we're hoping you're learning from this, right? That you don't have to work by yourself, that you can. Right. Go ahead.
I was like, and so you really allow the experts, right? The experts in each area to be able to
Yes.
do what they do best. So, I mean, you as a PTSA, you don't have to do the evaluation yourself, right? That's what an academic partner is dying to do. And you'd be surprised. It might sound hard. You're like, oh, well, what do I do? Where do I start? You'd be surprised how many researchers are trying to get access into the community. And you are that ability, that avenue, and that road for them to do that. Same thing with community agencies. They're always applying for grants. They're an expert in applying and how to apply for funding and grants. And you'd actually be surprised that some of them might already have these grants, and again, are just looking for the community members that are willing to partake in it with them, right?
And do the work, right? Like here's the money, but you have to do the work. And that's where that you're already set up to do the work. You're there, you're already willing to put in the volunteer hours. So that's the big takeaway here is like, if you find these people to help you, I have no money, like my PTA has no money, but we're able to do these amazing things because we've partnered up with these organizations.
And to give you an idea about how much money we've been able to fund around throughout this entirety of the last, so it's been 5 years now, we have raised $250,000. So we just got a new grant of $100,000, so $50,000 over 2 years, right? And then so in the next 2 years, I would have had a total of $250,000, right? So there is money out there to do serious initiatives and get things done. And
right.
You just need that little help to know how to find it. And when you're thinking about that, it is really helpful, as I mentioned before, establish your name, your mission, your vision, and your annual goals, because it really leads your momentum forward. Preferably if possible, but it's not completely necessary, but it is really helpful to establish a governance document, because it's always great when you're in agreement, but when you don't agree for some reason, it's going to happen every now and then. It's perfectly fine, right? It helps you to decide how you can still move forward. And so it helps you to establish those voting methods, right? It also, as you're starting to pull each other together, understand each partner's available resources, because when you start to understand those available resources, you'll start to see all the different branches and where you can lead to, and different ways you can use that funding, paid staff to move things forward, because a lot of times people just don't have the time to do that. It can pay for equipment, supplies, it can pay for advertisement, radio ads, social media, all these different things that you need when you're trying to let people know what you're doing. And then again, evaluate. I can't stress enough the importance of it, because when you're looking for funding, that is what funders want, right? They want to be able to
so many meetings
how this thing has worked, right? So how is it that what you decided to do has worked, and how you can define that you have done what it was that you were set out to do. And if you don't want to do all that work, that's fine. Join something else that's already established.
Anybody have any questions?
Oh, yes, I had a question, because you guys have given a lot of information. I'm like in overload here.
I'm sorry. Yay, that's great.
It's all really great, but how do we get started exactly?
Well, okay, so first, so is your goal, if your goal is this, right, health and wellness, then we started because we had that BMI thing and we knew there was a problem, and our principal, Flippany was already in our school, but so she reached out to Flippany first, and then they reached out to me as PTSA. But she could have easily reached out to me first, and I would have met with the people that I know are working in the school, and we sat down and had a meeting all together. So if health and wellness is an issue in your school, who is your school already partnering with in your school? Is there a group like Flippany? Is there a group like Boys and Girls Club? Is there a group? Who's your aftercare group?
Yeah, we have aftercare. Yeah.
There's probably somebody in there already that's doing some sort of program for health and wellness in your school. I would start there and work out, and then work out who are their partners, who, right, Christine?
Yeah, I was like, and start small. You're not going to get all these different people at the same time, right? I would say if you're going to start with someone, if you already have the backing of your school, right? Because first you kind of want to start with getting that backing of your school. If you already have the backing of your school, the next part to reach out to, I would say, would be that local nonprofit, right? Because that local nonprofit is most likely going to have some kind of programming that they will absolutely be happy to hear that someone wants them to come into their school to help, right? And then start to see your resource in terms of an academic partner. And I have provided you can always, our email, hshc@flippity.org, will actually reach me, Sharon, and Raihana. So I'm always happy. If you're looking to do something similar, I can absolutely help you with specific questions on, who's next, what, nonprofit might be willing to take part and do this and move this along for you.
Okay, great. All right. And of course, we tried to do the food recovery program before, but they've now ironed out, because there was some issues and it wasn't clarification on certain things, and we tried to do it before COVID too.
Yeah, so before COVID, they had actually approved it. We were ready to go.
Yeah. Did you go to the trainings?
Pardon?
Did you go to the training?
Yes, yeah, because we were gonna do it. But then there was some issue they still had to iron out in terms of, because there was some issue about staff couldn't touch the food. It had to be all volunteers.
Yes.
And
It
our
has to be
teacher,
all volunteers.
and then I know the cafeteria workers and our principal just wanted clarification on that.
It's all volunteers, and you have to train all of your volunteers. You have to keep logs of temperature checks, and it's extensive what you have to do.
I know,
Yeah, but we did right before COVID hit, we had a whole I had a training with 12 volunteers, I think, that were going to do it. And we were actually going to even.
What's the school that you're connecting to?
Yeah.
Oh, sorry. I'm talking and my mute is on. I'm at Pembroke Pines Elementary.
Okay.
And we actually already had a food pantry and a food. We would have oh my gosh, what's it called? Food distribution.
Yeah.
Yeah.
We used to do that before COVID.
That's wonderful.
Yeah.
Yeah. So who to talk to is Elaine. I can't think of her last name. She's at Beachside Montessori.
Oh yeah, my son was.
Yeah.
Elaine Fiore.
Thank you, Fiore. Okay. She's the expert on all of this. For real, the expert. She came to our conference last year and did a whole presentation on it, which is, and I met her actually at a different event at a health and wellness committee meeting for the district, and was sold right then. We're doing this, and I took it back to my principal, and I'm we're doing this, and but with our partner, we were able to purchase because you need your separate refrigerator, you need your separate, everything is separate from the cafeteria. So you have to be able to do all of those things, and cafeteria staff can't touch anything. Teachers can't, it's all volunteer. It all has to be logged. So she's correct, your principal, and you have to have it signed off too. So it's a multi-step process for sure.
And the good thing though is that it sounds like you have infrastructure at your
Yeah.
school. So
We already. Yeah.
If you contact me at that email below, or the one that you see there.
Yeah, because we have refrigerators, we have coolers, everything.
Yeah. So it sounds like you're half the battle's over already. Yeah. Anybody else have any questions? Let me see.
Sharon, it's
Yes.
Latha.
Hi, Latha.
How are you?
I'm good.
Yeah, well, couple of questions. One is not about the program, but it intrigues me that you found out that the BMI it was high in your school. Do pediatricians, when I looked at that questionnaire, do pediatricians check that routinely anymore, or not? Because how do parents that get that information, if they had it, they wouldn't feel so insulted or, you know.
So at the middle school level, they only get checked in 6th grade.
Mm-hmm.
And you only get a letter, right, if it's above the certain percent.
Mhm.
And when your school is 82% free and reduced lunch, a lot of those kids don't get yearly
Right. They don't have
physicals.
doctors.
They
Yeah.
don't go every year. So this is the only access they have to those BMI scores. So then when they're getting a letter from their school that says you need to go to a doctor, they don't go to a doctor because
And
they don't,
I think part of that is, do they have access, right?
right,
Mhm,
they don't have
mhm.
insurance or they don't
Mhm.
have, right. So that was part of the reason why it was such a concern for us, because we know, one, there's a lack of access. They don't get yearly physicals, and sixth grade's the last year. So if you don't
Right.
catch it by sixth grade, it can become this blooming, lifelong issue. And
Mhm.
especially the only time they even require physicals in school is if you're doing sports, right? Like you have to do your vaccinations, but you can do those like at a well clinic or whatever, but you don't need an exam for that. And then if you don't do sports, you don't need a physical at all. So a lot of kids never get a physical at all.
But,
So
but to answer your question directly, physicians they do check for.
yes.
Okay.
Oh yeah, they definitely check
It is-
BMI, but a lot of the kids don't go.
Right.
So that,
it's still the best practice for pediatricians, and
yes.
they do it throughout. Really, they still even do it.
I'll tell you, my kids just went for theirs.
Even to your
And they did it.
Mine are 18 and 16 years old, and I got their BMI and I got here's where they are on the chart and
Yeah.
where they were last year.
So if you go, the other question I had, or not a question, I noticed that kids are reluctant to go to the shared table or access that. There needs to be a way to have them overcome it, and I wonder, what you can do.
And
And
that's actually a great comment, because that was part of what we, at seeing that, we realized that one of the initiatives that we need to focus on is actually having them understand what it is, creating posters. And so that's something that we probably would not have thought of at all
right.
had we not done those tests, right?
Right.
Right.
And you can provide feedback. When I looked at that picture, it was all the fruit, whatever
Crazy,
fruit
right?
that was, an apple or whatever, and milk. I saw milk at the very end. And go back to Mary. I forgot her last name.
Mulder.
Mulder.
Yeah. I
Give them suggestions as to what kids are not eating.
I actually, I'm going to pull that picture from the slide. I have my first health and wellness committee meeting this week, and I'm
Right.
going to show her that. Like, I know this is what's provided, but maybe there does need to be a different alternative, or,
And
but
we even noticed really simple things, like, for example, and one of the ones that we did, the pineapple, was one of the ones that a lot of the students were leaving. And really, one of the only reasons why they were leaving was because it was so difficult to open the packet. Which is funny. It's something so simple. Like, it was because of the packet, but when you were asking, it was so hard to open the packet that they would just leave the pineapple.
and it's oranges they don't like either, because it's hard to peel and they're sticky the whole day and they're not allowed to go wash their hands. So it's like the silliest. Sometimes the barrier isn't that, I mean, they're hungry, but it's more trouble than not to eat what's provided. So those are
and
things.
if they are required to take certain things when they're on free and reduced, there needs to be just some adjustments so that they take what they will really eat.
And there actually is. So that's the other part of the other initiatives that we need to do as well, right? So there's this, you can take 3 out of the 5, but a lot of the students don't know about it, right?
So they take all 5.
Of being able to help with that recovery as well, of making sure that at least it does not go to waste by being able to help with more of that promotion, so that they understand that they don't need to pick 5, they can pick 3.
Well, but it's a great program. I congratulate you both, because when you look at the lines at food banks and in this COVID situation, it is so great that even 75 boxes that you got out was great, because people need food. And whatever we can do to encourage these children to eat while they are in school, because that's probably the only meal.
So we're really hoping to get to the 1,500 very soon. As soon as we have access to that, that's really what we're trying to get at. So thank you very much.
Well, congratulations. It was very, it's such a worthy program. So
Thank you.
Yeah.
We've worked really hard on it. You can tell, right? It's been years, but that's the point, right? And that I hope is what everybody's main takeaway is. Like, it's a process, and and that's everybody's goal should be longevity, right? So don't think that everything has to be done in a year, and to reach out to these groups because they can help with that longevity, and long after you're gone, that group can still be there functioning because your PTA was part of it. So that's what I want everyone to take away mostly, that don't be
Absolutely.
discouraged.
I want to
Okay.
say thank you, everybody, for
Thank
joining
you.
us tonight. I do want to be mindful of everybody's time.
Yes, we're done. Sorry.
I
You know me, I talk a
Well,
lot.
time for the debate, right?
Oh,
know.
yeah. So we have
Right
to
on
thank,
time.
thank you to our sponsor Hazel. Thank you to everyone that joined tonight. And after the conference is over, all of the classes will be available on the website to rewatch. So if you have more questions or you missed some information, they'll all be on the website after the conference is over.
Again, thanks for joining.
Thank
Hazel
you.
Health is founded on the mission to ensure all children
That
have
sexy
access
voice
to
again.
quality health care. By partnering with school districts across the country, students
Why,
get
thank you.
on-demand doctor help in school because Hazel telehealth services
I love
improve
it.
student health and academic success.
That's funny. Sorry. Did I embarrass you?
No,
Lovely.
just a little
That's
bit. Yeah.
Cheryl's voice, Sharon.
I love
Yeah.
it.
Hey, I actually had a question because I
Oh, yeah,
couldn't-
sure.
as a telehealth provider, how could we help, especially with conversations around BMI as we have students visit our virtual clinics? Is there a role that
Hi,
we can play?
Latha. I'm sure there
Sharon.
is. I'm sure we could make that part of the conversation.
Sharon,
Okay.
Gerald is from Hazel.
Hi, Hazel. Hi, what's your name?
Hi, Gerald.
Hi,
And
Gerald. Nice to
and I
meet
know
you.
we're at time, so we could actually connect. Bert could connect us up, and
Oh,
we could
yeah.
talk a little bit more about how we could work together. But
I think that's
very intrigued.
wonderful.
We would be
Yeah.
so happy to have that conversation.
Like,
Thank you so
wonderful. Yeah, totally.
Sounds great. All right. Well, y'all have a wonderful evening.
You
Thanks
too.
so
Thank
much.
you.
much.
Did I
You're
get
welcome.
everybody
Bye
in
now.
chat? Everybody's
Thanks for your
happy.
partnership, Gerald. We appreciate
Yeah,
it.
it was great. Thank
You're
you.
quite welcome. Thank you.
Thank you
No,
so
he
much. I just got to say, you have a great voice.
I know. I didn't know he was on when I said it was sexy.
Thank you.
Uh-huh. There you go.
All right.
Ramon.
Uh-huh.
All right.
Take
Thanks,
care.
everybody.
Bye-bye
Good
now.
night, everybody.
Bye-bye.
Be well. Take
Be
Be
care.
well. Be well. All right, Christine. That was great. Thank you.
You're welcome. Thank you.
You did a great job.
Thank you.
Pleasure.
Did you hear anything about the food for this week?
Yeah. So
All
I should
right.
try tomorrow, though.
All right, that's
I'll
fine. I have
call
a call into Bolton, so as soon as we know something, I can let him know.
I'll call her first thing in the morning.
You rock.
Thank you. Thank you.
Kisses.
That's
Bye.
great, but you rock. You're like all over the place.
No, I'm
50
sorry.
things a day.
Good night, Ramon.
All right.
You
Good
know
night,
how
everybody.
I do. Just starts
Thank you. Have a
coming.
good night, everyone.
Bye,
too.
everybody. Thank you.
You're welcome. All right,
You
bye-bye.
good, Bert?
Guys.